From WRAL News and the Capital Broadcasting Podcast Network, this is your coronavirus news brief for Friday, January 22nd, 2021. I'm Deborah Morgan. Before we get into the latest stories, we want to ask a favor. We're trying to get a better understanding of what you, our listeners, want to hear in this podcast. We have a survey that takes about 5 minutes to fill out, and we would really appreciate it if you would fill that out. You can find it at WRAL.com/coronapod. Again, that's WRAL.com/coronapod. Thanks so much. Now for the latest coronavirus headlines. For many, getting to a COVID-19 vaccination site can be difficult. That's why the State Health Department announced a major partnership with NCDOT. Dr. Mandy Cohen announced $2.5 million from the COVID-19 Relief Fund will go to local transit agencies across the state. This funding will help pay for people who need rides to COVID-19 vaccine sites. NCDOT says this will help 30,000 people get their vaccine.
Governor Cooper is committed to deploying every resource to make sure people have access and are not held back by barriers like lack of transportation. That's why the North Carolina Department of Transportation is launching a program to pay for rides for people receiving a COVID-19 vaccine.
More than 47,000 people requested appointments for vaccines in Wake County this week. WRAL's Amanda Lamb explains how the county health department prioritizes who gets the calls to receive their shots.
77-year-old Bob Jennings of Holly Springs has been trying to get an appointment to get the vaccine at the Wake County Health Department.
7 hours on the computer.
Jennings has COPD.
I don't know how to explain my frustration.
But underlying health conditions are not a criteria in this phase.
Pre-existing conditions should be a factor that they should consider.
The vaccine priorities are healthcare workers, nursing home staff and residents, and then people 65 and up. For this group, the county is looking at zip codes where they live. The higher the positive test rates there, the higher you are on the waiting list.
It says, okay, you're on the list. What list is that?
Currently, the top 4 zip codes with the highest percentage of people testing positive are in Zebulon, Willow Spring, Wendell, and Knightdale.
So I am totally supportive of them prioritizing giving those individuals the vaccine before they necessarily try to reach into other zip codes if you have to make a choice.
Wake County Representative Cynthia Ball understands everyone's frustration, but she says the health department is only getting a small percentage of the doses. 74% is going to area hospitals. She says Wake County needs more vaccine.
We're going to have a whole lot more capacity.
Ball, who is 67, recommends shopping around for your dose. She's currently on 2 waiting lists.
And so I'm going to be like everybody else, trying to get registered at whatever ones will take me.
And on Thursday, the state updated its county alert map. 99% of the counties are now considered red or orange. Rural Greene County in eastern North Carolina is the sole yellow county. For the North Carolina Coronavirus Podcast News Brief, I'm Deborah Morgan.